Hi everyone, Michael and Megan Crick here, and welcome to part 2 of our posture series. So this second part is about what, Michael?
Lower body posture. So we talked about upper body rounding. A lot of times we see lower body, we see what's called lordosis. So kind of it's an extension of the lumbar spine. So like a rounding in. Think about your belly kind of coming out, and then your hips are actually rotating anterior. So imagine a bowl between your hips and you're dumping water out the front. It's called anterior pelvic tilt. It's super common, and it's from we live in a sitting culture, so the hips tend to round forward. We also live in a very forward-driven culture, so everything we do is hip flexion, hip flexion, hip flexion. Cycling, running, yoga, sitting, standing, hiking, whatever your activity is, there tends to be a lot of hip flexion, which tightens those muscles in the front of the hips, right? So your hip flexors do what? Anybody? Yes, they do. They actually flex your hips. So what we want to do, same thing, upper body, we open, strengthen. Now look at the hips. We're going to open, tighten, okay? There's also a whole bunch of different core exercises you can do. That's a whole nother video we'll get into. But for now, some basic exercises. If you feel yourself with that lordotic curve, that tight lower back, some great stretches you can do. You can start off hip flexor stretch or your iliopsoas, which actually runs from the top of your femur bone through your body and connects to your lumbar spine. So it's actually the only muscle that connects your trunk to your lower extremities. Really important to stretch and lengthen. So you just get into a lunge, put your hands on your front hip, push that hip forward. Try to stay out of the low back here. Same thing with the breath. Breathe in, expand. Breathe out, release. Get a little more depth. I like to add the arm up and over, looking up. And about 30 seconds, focus on your breath. And then from here, we're going to go into the quadricep, which is down below the hip flexor. Drop down on your hand, reach back with your opposite hand, and just pull that foot in. Now we're getting down towards the knee. And you can rock side to side here, just finding where you're tightest. Same thing, about 30 seconds, focusing on your breath.
And this is all opening up the
front of the hip and the leg.
Of the hip and the leg.
Upper leg. 30 seconds of each, both sides. If you find one side is tighter than the other, you could go back to it. So then, hips are nice and open. Good. Now what do you want to do? We want to tighten your glutes, your posterior, right? So to do that, super easy exercise. Lay down on your back. So we're going into hip extension now, not hip flexion. So you just lay down, hands to your side, relax your shoulders. Push into your heels here so you can actually lift the toes a little bit. Pull the core in, and then you want to breathe out. Squeeze up, squeeze the glutes. Your gluteus maximi, two here, are actually the biggest, strongest muscles on your body. So down, up. Going with your breath, really squeezing. Try to keep it out of the low back. Once again, the tendency is to go into those low back muscles. We want to release those, pull in the core. 3 sets of 10, same thing. A couple days a week, you're going to notice a difference, especially combined with the stretching. You'll notice a difference in the tension in your hips and also your low back. So, yeah.
Very important. And if someone isn't sure where they're at, this is measurable. There is an optimal position, correct?
Absolutely. Yeah, and we can do that here. So for women, it's actually 7 to 10 degrees, and for men, it's 4 to 7 degrees anterior tilt.
Good to know.
Yeah.
Okay, you guys, if you have any questions, please let us know, and we look forward to bringing you more stretches and exercises such as this. Thanks!